From the PEP Radio Newsroom, this is the News Blast for this hour. LGBTQ Nation is reporting that the Department of Health and Human Services opened a new and novel front in its crusade against trans people with the announcement last week of an investigation into hospitals over gender-affirming care and a claim that health workers may refuse to administer this care based on their religious beliefs. The Office of Civil Rights for HHS launched a probe on June 20th investigating the University of Michigan health system based on allegations that the hospital fired a nurse's aide for exercising her federally protected rights of conscience. The Civil Rights Office has framed the probe as a review of the hospital's compliance with the Church Amendments, a set of laws written to address health workers' religious objections to reproductive rights. The law has never been used in the context of gender-affirming care for trans people. Health and Human Services is, quote, committed to enforcing federal conscience laws in healthcare, said Paula M. Stannard, director of the department's Office for Civil Rights, in a statement announcing the investigation. She continued, quote, healthcare workers should be able to practice both their professions and their faith, end quote. Health and Human Services said the investigation of the University of Michigan is the third probe in a larger effort to strengthen enforcement of laws protecting conscience and religious exercise for medical providers. The Michigan probe follows a lawsuit filed by the nurse's aide, Valerie Klusterman, who claims she was compelled to pledge against her sincerely held religious convictions and her medical conscience that she would speak biology-obscuring pronouns and make referrals for gender transition drugs and procedures. Her lawsuit was dismissed in 2024 and then appealed by Klusterman's counsel, the First Liberty Institute, which advocates for religious liberty plaintiffs. The U.S. Court of Appeals for the Sixth Circuit heard arguments in February and has yet to issue a decision. The second and third cases under review involve ultrasound technicians who refused to abet pregnancy termination procedures that were contrary to their religious beliefs or moral convictions, and a nurse who asked for a religious exemption to avoid administering puberty blockers and cross-sex hormones to children, according to the Department of Health and Human Services. The Church Amendments date back to the 1970s and allow healthcare institutions and providers to refuse to participate in pregnancy termination or sterilization procedures. The new probes are the first time Health and Human Services has explicitly claimed the amendments, quote, allow providers to refuse gender-affirming care or to misgender patients, end quote. Elizabeth Sepper, a professor at the University of Texas who studies conscience laws, told Michigan Public for KFF News. Those laws primarily allow objections to performing abortions or sterilizations, but don't apply to gender-affirming care by their very own text, she said. Some of these also apply to end-of-life care and to physician aid in dying. So they have a relatively narrow scope, Sepper said. They focus on a set of procedures. They don't allow healthcare providers or institutions to refuse to provide all kinds of care based on their religious or moral objections. The investigation sends a message that the administration will investigate or otherwise harass providers of gender-affirming care even when that provision is legal in the states where they operate, such as Pennsylvania, said Sam Bagenstos, general counsel at Health and Human Services during the Biden administration and a professor at the University of Michigan. This case is an extreme stretch of the conscience protections and probably more than a stretch, he said. By taking up these investigations so publicly, UT's Sepper said Health and Human Services is putting health systems in a very difficult situation. Anti-discrimination laws require them to treat transgender patients equally, she said, but now the administration is prioritizing employees that might want to make it more difficult for transgender patients to receive care. The new tactic, she added, is meant to offer red meat to the anti-LGBT rights movement to tell them that Health and Human Services is squarely on their side. That's the News Blast for this hour. If you are watching our videos on YouTube, please subscribe to our channel. Download the Live 365 app to take PEP Radio with you wherever you go. Up next, we have the Meadville area weather forecast here on PEP Radio.